nice camera yet.
Okay.
Soon.
Well, what's really interesting here today is I have two gentlemen who each have had missing lateral incisors, and they both are missing 7 and 10, and they were both handled a little differently. They just met each other, and Clive, why don't you tell a little bit about what happened for you, and just describe and you can take a look. Albion. Just show them what happened, and just describe briefly.
So yeah, basically, in junior high, my baby teeth next to my front teeth weren't coming in at all. They didn't leave. There was no tooth pushing it through, and eventually realized there's no tooth gonna come through at all. And then my canines, I guess, I'm not sure the technical name for them, incisors, but they grew in sideways, and so it looked like I had kind of beaver teeth or something. So these sideways teeth sit next to them like big almonds. And so what we did was we're trying to figure out if we wanted to pull them apart and pull them all back and then put implants in, or the new procedure, which was available at that point, but just becoming available, was pushing them all forward and reshaping all the teeth to look like the teeth next to it. And so that's what we ended up doing. And so I have 6 veneers, and they're all shaped to look like the tooth behind them. And luckily it worked out fine. I haven't had a problem yet. They're all strong enough. Even my canines have had some, issues keeping them clean. Like I haven't got enough cleans here, I guess. But besides that, they're like excellent. Completely different. Like they're literally twice as long as they were.
Yeah.
And so my teeth, usually when I smiled, I couldn't even see all the way to my teeth because they were just so high up, and it looked kind of awkward with me, So yeah, it's been a huge miracle. It's a long process. It took, I don't know, maybe 5-6 years, but well worth it.
Well, you had the orthodontics too, and you had to go through a second time.
Yeah, luckily got it done early, so after high school I was completely fine.
Now, for the same sort of situation, Albion had a different story, and Albion, tell him your story.
Okay, so I never got the laterals, and my canines migrated over to fill in the gaps, and then they started, especially the one on the left here, started crossing over the front tooth, and I started biting the inside of my mouth. So I was biting over and over, and that's when I came to Brack, and he worked up the treatment plan, and I wound up having braces for 2 years and 2 months, and then put veneers on the front 2 teeth, and I got implants here, which today I just got the very last crown on this left one, and I've got 4 veneers on the bottom, and then resin buildup on all the rest of my teeth. Everything was broken, and these teeth were just worn down halfway. They were awful. So here I am today. Thank you, Brack.
You're very welcome. Can I get a picture of both of you just kind of a little close together, just side by side? This is kind of an interesting look here. Well, 2 good-looking fellows and 2 different results, or 2 different approaches to handling the same situation, but 2 different styles of treatment. Thank you both. You're great patients, all of you. Thank you.